Hello, my beautiful people. Welcome to Be Well with MS podcast. I'm your host, Dr. Agne Straukiene, and today I'm thrilled to introduce a landmark publication that I had the honor of leading alongside a team of esteemed experts in the field of multiple sclerosis. Our article, recently published in Frontiers in Neurology, represents a collaborative effort of specialists from various different disciplines. This team includes Professor Gavin Giovannoni, Professor Helen Ford, Professor Klaus Mierer, Professor Rod Middleton, Dr. Andrea Stennett, Dr. Ian Pomeroy, Dr. Leonora Fisniku, Dr. Antonio Scalfari, Dr. Colin Bannon, Ruth Strauss, Sarah Hughes, Adam Williams, Samantha Josephs, Charlie Peel, and myself. In this episode, we will explore the insights from this article, which aims to reshape the way we think about MS care. We will delve into the integration of advanced therapies with a holistic management approach, offering practical advice and insights for those living with MS. So whether you are a patient, a caregiver, or just interested in learning more, this episode is for you. In the management of multiple sclerosis, early intervention is critical. The article MS Care, Integrating Advanced Therapies and Holistic Management, on its own covers the advanced therapies in the title, emphasizes the pivotal role of early and aggressive treatment with disease-modifying therapies in multiple sclerosis. Studies, the research, have consistently shown that early focal inflammatory activity in MS can lead to faster brain degeneration in the long term. That means the loss of volume, loss of cells within the brain. Therefore, implementing early aggressive treatment with disease-modifying therapies, which is common therapy in multiple sclerosis, is correlating with significant improvement in clinical metrics of the disease, including the rate of the relapses. That means that diminished relapse rate in a year's time. Disability scores are better, so people are slowly progressing, or if progressing at all, living with MS, and have got less MRI activity if people with MS starts aggressive early disease-modifying therapies. However, it's important to note that even with effective control of inflammatory activity, MS may still progress subtly over time. This underlines the necessity of initiating effective disease-modifying therapies as soon as possible as MS diagnosis is made to protect neurological reserve and to maximize lifelong brain health. In conjunction with these treatments, adopting a brain-healthy lifestyle is equally crucial. A brain-healthy lifestyle includes factors such as nutritious diet, regular physical activity, and mental well-being practices. This dual approach, combining pharmacological treatment with lifestyle interventions, is now recognized as an essential component of MS care, offering the best chance of preserving brain tissue, central nervous system integrity, and minimizing or delaying further decline in multiple sclerosis patients. We will be discussing the importance of brain-healthy and metabolically healthy lifestyle and how self-regulated lifestyle modifications can directly impact disease progression and improve outcomes in people with multiple sclerosis. Before we dive into the specifics, I want to set the stage for today's discussion. Our approach in this article and in this episode is to provide you with actionable insights and information that can inspire you in your journey with MS. We will cover everything from the importance of early diagnosis and treatment and the role of diet, exercise, and mental health in managing MS. Over the next 12 minutes, we will explore each of these aspects in detail. We'll discuss how physical activity tailored to individual needs and abilities can enhance quality of life. We will delve into dietary recommendations and how certain foods can impact brain health. And importantly, we'll talk about the emotional well-being of those living with MS, covering evidence-based methods like cognitive behavior therapy and mindfulness. So today we are unpacking some fascinating insights from the article in Frontiers in Neurology. It's all about combining advanced medical treatments with a brain-healthy lifestyle to manage MS. So whether you're newly diagnosed, a long-term warrior, or supporting someone with MS, this episode is for you. Multiple sclerosis is a neurological condition that affects the brain and spinal cord. It can cause symptoms like fatigue, cognitive impairment, sensory or motor disturbances. But every MS journey is unique. The disease is unpredictable and varies greatly from person to person. Today we are focused on how lifestyle choices, in addition to medical treatment, can positively impact this journey. So, the importance of tailored exercise plan. Exercise is a game changer in multiple sclerosis management. Regardless of your ability level, engaging in the physical activity is key. This article suggests starting small and finding activities that you enjoy. This could be anything from yoga, swimming, to walking, whatever suits your ability and interests. It's about building a routine that is tailored to you and adaptable as your needs change. Regular physical activity can improve muscle strength, mobility, and overall quality of life while reducing fatigue and depression. Now, what are the nutritional strategies for brain health? Well, as we know, diet plays a massive role in managing multiple sclerosis. The brain needs the right nutrients to function well. This means eating a diet rich of fruits, vegetables, and omega-3 fatty acids. Think Mediterranean diet. It's linked to better mental health and reduced depression risk. It's not about a complete diet, but making a gradual, sustainable changes. And remember, what you eat can impact inflammation and the brain health. Now, emotional well-being and community support. Taking care of your emotional health is just as important as managing physical symptoms. Depression and anxiety are common in MS, and there are ways to tackle them, like cognitive behavior therapy, mindfulness, and staying socially connected are powerful tools to help you. You're not alone in this. Support groups, both online or in person, can be incredibly helpful. Sharing experiences and tips with others who are on the same boat, who understand, and can be incredibly empowering. There are so many charities around like Shift MS, MS Together, MS Trust, MS Society, and so many other communities that could help you to be yourself, to achieve the best what you can living with this condition. So to wrap up, managing MS is about finding the right balance between medical treatments and a healthy lifestyle. Remember, every MS journey is unique, and it's about finding what works for you. If you're interested in learning more, I highly recommend reading the full article in Frontiers in Neurology for deeper insights. I'm going to share the link to access this article in the show notes. We discussed the importance of early diagnosis and prompt treatment in multiple sclerosis, which are crucial for preserving central nervous system brain and minimizing further decline. Our article, a collaborative effort of experts in the field, underscores the necessity of both effective disease-modifying therapies and a brain-healthy lifestyle from the time of diagnosis to protect neurological reserve and maximize lifelong brain health. We delved into the significance of tailored care that responds to the individual needs of people with MS. This approach is not just about medical treatment, but also about fostering healthy lifestyle behaviors, which often require support from family, healthcare providers, and the broader community. It's crucial for healthcare providers to guide individuals with MS and their families towards resources and support groups that can assist with lifestyle behaviors such as smoking cessation, engaging in physical activity, and following healthy eating advice. Furthermore, we emphasize the importance of early educational input and ongoing support for people with MS. This support is vital to ensure that individuals with MS proactively manage their condition, have the necessary knowledge and resources to handle comorbid conditions. Any alternative to MS diagnosis also requires a lot of care and management. And that could be implemented by adopting healthy lifestyle practices. By doing so, we can help alleviate the burden of MS and improve overall quality of life. In closing, remember that managing MS is a collaborative journey. You're not on your own. It involves not just the individuals living with the condition, but also their families, healthcare teams, and their entire support community. Together, we can make a significant difference in improving the lives of those affected by MS. So thank you for joining me today on the Be Well with MS podcast. I hope this episode has provided you with valuable insights and practical guidance. For more information, don't forget to check out the full article in Frontiers in Neurology, which I will share in the comments on the media or in the show notes. Stay tuned for more episodes where we will continue to explore ways to live well with multiple sclerosis. Don't forget to subscribe to my channel, to Be Well with MS initiative. That enormously supports me to provide more content, more information, living well, living healthy with multiple sclerosis. Bye for now.